The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice.
Sweaty and pissed. Menopause makes me sweaty and pissed.
Hello, everyone. Welcome to Sweaty and Pissed, Menopause and More. I'm Karen Nickel, nurse practitioner, and I'm here with Forrest Wenzel, our producer and our theme music composer, and he's going to join me today to answer some listener questions.
Hello,
hey,
glad
Forrest.
to be back. Hi.
Yay! So good to have you.
Our first question is from Stephanie, who's asking if you can talk a little bit about the Cologuard, and she's wondering who's a good candidate for the mail-in test.
Okay, that's a great question. Cologuard is a home stool test, a test that you collect at home from a stool sample, and it is a cancer screening, colon cancer screening test, and it is indicated for people ages 45 and up, and it's only for people who have no risk, so no family history of colon cancer, no personal history of colon cancer, no colon diseases like inflammatory bowel disease. You're just a low-risk person with a normal colon who is screening for cancer. So that's the person who can have this test. And it's very easy to collect the sample at home. It is a prescription, so as a provider, I order the prescription, and then they ship you the kit directly to your home. You collect the sample, and you ship the kit directly back to the lab. And then they send me the result. And what it looks for, it's looking for blood in the stool, for one thing, and it looks for 11 cancer biomarkers. And if you have a negative test, it's over 99% positive that you will not have colon cancer, that you do not have colon cancer. So it's a very accurate test. They do have a 13% false positive rate. And what that means is if it's false positive, it means you get a positive, but you really don't have colon cancer. They also have an 8% false negative rate, meaning the test came back negative, and indeed you do have colon cancer. So there is that bit of risk when you're having this test to screen for colon cancer. The other thing that I tell my patients is that although Cologuard is very well covered now by your insurance, if you have a positive test, positive Cologuard test, the indication then is for you to have a diagnostic colonoscopy to see what's going on there. Most insurances cover a screening colonoscopy 100%. Even though a diagnostic colonoscopy is exactly the same test, because it's diagnostic and they're looking for a problem, it changes the category of the coding and the insurance coverage, and that test, the cost will be part of your deductible. So I always warn people that if it's positive, then you may, and you have a big deductible, then you may be paying all or a good portion of that colonoscopy cost. Whereas as a screening colonoscopy, it would be, in most insurances, covered 100%. So you need to be aware of that if you want to use the Cologuard as your screening tool. But it's very easy test. I do have a lot of patients who use it, and it's been a very effective way to get a screening test without a colonoscopy if you're at low risk. So I appreciate that question. I know that there are a lot of people who are interested in that test and are happy to hear a little bit more about what's involved and what it covers and doesn't cover.
So the next question I've got here is from Jill, who's asking if you can tell us the name of the medication you mentioned that was originally used for a different purpose, but in small doses can be effective for many things, including restless leg.
Yeah, Jill, I had to think about this one because I talk about so many different medications. I was like, what is she talking about? But I believe what you're thinking of is low dose naltrexone. And naltrexone in larger doses is used for drug addiction, to treat drug addiction. But in very, very low doses, we can use it for a lot of different problems, many of which are autoimmune related. We use it for fibromyalgia. It can help with restless leg, as you said. And so that is a prescription, low dose naltrexone. So we use it in like 2, 3, 4 milligrams. And because it's so low dose, it's not manufactured in those low doses. So that medication has to be compounded. So you do need a prescription and you do need to have a compounding pharmacy make it. So there is a website, lowdosenaltrexone.org, if you want to see some more information about that option. That's a great question. We have good listeners, don't we, Forrest?
Yeah, we do. And she also mentions that she has been using black cohosh and milk thistle. And is that how you pronounce that? Black cohosh?
Yeah, black cohosh.
Cohosh. And she's got a new bioidentical progesterone from her new compounded pharmacist, and that she would never have gone that route without the podcast. So
That's great to hear. I hope you're feeling well on that regimen, and it sounds like a very good regimen indeed. So I'm glad that our podcast helped you with that. That's really good news.
So let's take a quick break, and we'll be right back and answer a couple more questions.
Indeed. If you do not love your hair, or if you do not love your hair products, I suggest you leave those products that you used in 2020 behind, and in this new year, try Function of Beauty. Function of Beauty is where you can get your hair care personalized, customized, because they offer precise formulation for your hair's specific needs. And it's super easy to get started. First, you just take a quiz to tell them a little bit about your hair type. Is it curly, wavy, straight, oily, dry? And then you share with them your hair goals. Do you want your hair to be less frizzy, smoother, have more volume? And because your hair changes with the season, you can change your hair goals with every shipment. So if you have drier hair in the winter, you can get a specific formula for your dry winter hair. Then you choose your color and fragrance, or you can go fragrance and dye free. You can also go silicone free. Then the team at Function of Beauty takes that quiz, takes that information, and puts together a perfect blend of ingredients and bottle up your formula. They deliver it to you, and it comes with all the instructions you need on how to use the product. And every ingredient at Function of Beauty is vegan and cruelty-free. Their products never contain petrolatum, which I've told my listeners before, acts like an estrogen in your body when it's applied topically. So we want to avoid petrolatum in our skin and hair care products. It also is gluten-free, and I speak to my patients frequently about using gluten-free products if they have a gluten sensitivity. So you know that this product will always be gluten-free. And if you want a customized regimen from head to toe, Function of Beauty also offers completely personalized formulas for body and skin care as well. Never buy off the shelf just to be disappointed ever again. Go to functionofbeauty.com/sweaty to take your quiz and save 20% off your first order. That applies to their full range of customized hair, skin, and body products. Go to functionofbeauty.com/sweaty to let them know you heard about it from our show and to get 20% off your order. functionofbeauty.com/sweaty. Welcome back to Sweaty and Pissed, Menopause and More. And Forrest, what other questions are we going to answer today?
Our next question is from, and I'm sorry, I'm not sure how to pronounce this name, but I'm going to go ahead and try since I've said everyone else's name. But Vinine asks question about progesterone oil. She wants to know if the type of progesterone oil she's using, 10 drops to the wrist once in the morning and once at night, if that's a good hormone to use.
Yeah, so we don't know if it's Vianine or Vinine, but we are doing our best to pronounce your name correctly, and I apologize profusely if we're not. So progesterone, the product you mentioned is Progon B-L4X. And that particular product is a product that contains progesterone, which is a bioidentical hormone. And we've talked a lot about progesterone on this podcast, and it is a very good hormone to help with the imbalances we have with female hormones. So it's bioidentical progesterone that basically is suspended in rice bran oil, organic coconut oil, and vitamin E. So it's a very nice mixture and doesn't have a lot of ingredients, just those oils and progesterone. And 10 drops of that oil contains 40 milligrams of progesterone. So that's pretty typical to get either 20 or 40 milligrams in a cream or oil. And the oils are really nice for people. You can put it on your wrist or your what we call the antecubital, the bend in your elbow, the backs of your knees. And the recommended dosing on the label is 2 to 5 drops twice daily. And your doctor prescribed 10 drops once in the morning. So you can divide it 5 drops twice daily or 10 drops. He or she might be doing that. So we give the hormone receptors a little rest when we do it once a day. And sometimes that provides better benefit. So I think that's good dosing. And the product also is paraben-free, gluten-free, and it hasn't been tested on animals. So those are all good things. So it sounds like you're on a good regimen and using a good product, and I hope it's helping you.
Yeah. Our next question is from Brooke, who was taking a multivitamin with biotin, zinc, vitamin C all together, and it made her feel a lot of nausea. And she's wondering if there's any way she can take all those vitamins and not have the nausea.
Yeah, so it looked to me like she was taking a multivitamin plus an additional biotin, zinc, and vitamin C all together.
Yeah.
Yeah. So I did answer Brooke on the Facebook page, but I thought maybe other listeners might benefit from hearing this answer. Of those supplements, vitamin C is the most likely culprit to cause nausea or other GI problems. So I instructed her to separate out the vitamin C first. And if that helps, if the nausea goes away, then try taking the vitamin C with food or take a lower dose. Some people just can't tolerate high dose vitamin C. So that's what I instructed her. Some people do have nausea with just a multivitamin, but I think in that particular combination that she had, multivitamin, biotin, zinc, and vitamin C, that the vitamin C is probably the guilty party. And I know a lot of people right now are taking zinc and vitamin C to help support the immune system during the COVID-19 pandemic. So I thought sharing this with listeners might be helpful because there might be some other of you out there who are also getting a little nausea with your COVID-19 supplements. So vitamin C oftentimes is better to take with food to help with that, avoid that nausea or other GI symptoms. But that was a very good question. I really wanted to share that with our listeners.
I think we've got time for one more from Penny, who asks if it's possible for a low dose of estradiol to cause sore breasts She says she's had total hysterectomy, and her current mammogram was fine, but has this breast soreness off and on.
Yeah, and Penny was wondering if that happens to other people, and yes, indeed, Penny, it does happen to other people. And we've talked a lot about estrogen dominance on this show. And when we have had a hysterectomy, most of the time you are prescribed estrogen only because you no longer have the lining of the uterus that you need to worry about, because estrogen thickens the lining of the uterus and progesterone thins the lining of the uterus. So they figure you don't need progesterone because we don't have a lining, so why worry? But the problem with that is that progesterone is a really great balancer to estrogen. So sometimes adding progesterone to that regimen will help. But in your case, since you're on estrogen only, one of the things that I also advise people to do if they're having some breast tenderness is to add an over-the-counter supplement called DIM, D-I-M, D as in dog, I, M as in Mary, which stands for diindole methylene, and it comes from cruciferous vegetables like broccoli, and it helps clear extra estrogen from your body so that we don't have extra stores of estrogen that can trigger some of that breast tenderness, because that's why that's happening, is it's high estrogen levels. So adding DIM can help with that, and that's just over the counter at your health food store. Sometimes also if you're taking the 0.5 milligrams once a day, sometimes I will have patients cut that in half if your tablet's big enough and divide the dose to half tab twice a day, and sometimes that will help. But I think DIM would be a nice fit to help with your intermittent soreness of the breast. And I'm glad you got it checked out with a mammogram. That was wise, and I'm glad you made that decision to get that done.
Thanks for answering those questions
Happy
today.
to. So many good questions. It's just great.
Yeah.
We just really, really have terrific listeners, and
We do.
have had really wonderful feedback, which is nice, really nice. So I do want to thank, before we go, I do want to thank Function of Beauty for sponsoring today's episode. And I want to thank Forrest Winsel for producing and for being a partner on today's podcast. I appreciate that. And for your
Anytime.
beautiful music, we appreciate that too. And thanks Stephen Brown for his artwork. And we're so glad you're tuning in, and please keep the questions coming. I'm happy to answer them and hope that they're helpful. I hope you all are staying well and staying safe, and we will see you soon.
Sweaty